Now we are going to discuss tubes, catheters and drain. You can see this is an image of Romovac suction drain. So how we apply this? It is a closed suction drain. You have seen in the wards that after emptying the bag, the resident is going to press the corrugations. In this you can see that these are the corrugations. These are corrugations. So how we are going to use it? The resident is going to press the corrugation, so suction is applied and after that it is attached to the tubings. So we create suction by pressing the corrugations and then we are going to attach it with the tubings. So this is closed suction drain. You have noticed that in which patients we are using this? You have seen the patients in whom thyroidectomy is done. In those patients we are using Romovac suction drain. Patients of mastectomy, beneath the flap one limb of this drain is beneath flap and one limb is in the axilla, and it is also used in flap and reconstructive surgery. Okay, so what are the uses? So the Romovac suction drain, it is used in thyroidectomy, it is used in mastectomy, and it is used in flap and reconstructive surgery. There is another closed suction drain which was asked in AIIMS. So what's the name of this drain? This is Jackson-Pratt drain. In short, it is also known as JP drain. This is another type of closed suction drain. See, what are the parts of this Jackson-Pratt drain? So here you can see there is a grenade shaped bulb. What is the shape? Typical shape, grenade. Have you seen grenade? So there is grenade shaped bulb. Here you can see that there is stopper. These are the flexible tubings and this is the drainage end of Jackson-Pratt drain. See how we are going to apply this Jackson-Pratt drain. So in this picture you can see that this JP drain is applied. This is the part of bulb. So how we are going to apply? Here you can see that there is emptying cap. So we are going to open the emptying cap. We are going to empty the drain. After that we are going to press the drain. Can you see? Here this bulb is pressed. So the bulb of drain is pressed so that we are going to create the suction, and after that we are going to apply the cap. We apply the cap and then we relieve the pressure. So what? Suction is created. So what happens? The fluids are going to collect here. So generally in which conditions we are using JP drain or Jackson-Pratt drain? This is used to collect the bodily fluids in post-operative period. So here you can see it is used in post-operative period for collection of body fluids. Clear? So generally it is used in post-operative period. Okay, so there was image based question related to Jackson-Pratt drain in AIIMS. Now see, this is commonly used tube both in medicine and surgery department, and what's the name? This is Ryle's tube, also known as nasogastric tube. First question which was asked many times related to this tube, that what is the ideal position of insertion? If a patient is conscious, you have seen in emergency how we are going to insert. If a patient is conscious, the ideal position is sitting and neck flexed. And if patient is comatose, what is the ideal position? Supine and neck flexed. So first important point, what's the ideal position for insertion of Ryle's tube? In conscious patient, it is sitting position with neck flexed. Okay, and what about comatose patient? Supine with neck flexed. So if patient is comatose, the ideal position is supine with neck flexed. Okay, so this is the ideal position for insertion of Ryle's tube. Second, how to measure the required length of Ryle's tube? So how we are going to measure that how much length is required? So here you can see the length is measured from nose to ear to xiphisternum. Nose to ear to xiphisternum. Okay, so what's the mnemonic? It's necks. Can you see? N, nose, ear, and this is xiphisternum. So this is the length of Ryle's tube which is required in the patient. So this is how we measure, and this question was also asked in AIIMS. So how to measure the required length of Ryle's tube from nose to ear to xiphisternum. If you see in this Ryle's tube, you can see that there is presence of shots. Can you see the balls? So these are shots, and here you can see there are markings. So in Ryle's tube there are markings. So what are the levels of markings? And these markings indicate, so see, there is first marking at 40 centimeter, and this marking indicates what? G junction. So the 40 centimeter indicates G junction. There is second marking at 50 centimeter, and this marking indicates body of stomach. Third marking is at 60 centimeter, and the fourth marking is at 65 centimeter. The marking at 60 centimeter, it indicates pylorus. So this is what? Pylorus. And 65 centimeter, this is for duodenum. So 40 centimeter G junction, 50 body of stomach, 60 pylorus, and 65 duodenum. How to remember? Mnemonic is GBPD. It is GBPD. 40 centimeter G junction, 50 body, 60 pylorus, and 65 duodenum. What are the uses of Ryle's tube? So there are diagnostic indications and there are therapeutic indications. So see the uses. So first see the diagnostic indication. It is used for saline load test, and we discussed in which condition we perform this saline load test. It is performed for diagnosis of gastric outlet obstruction. So for diagnosis of gastric outlet obstruction, we perform saline load test. So Ryle's tube is used in that. To assess free and total acid, in which patients we are going to assess? In patients of peptic ulcer. So in patients of peptic ulcer, we are going to assess free and total acid. It is useful in the diagnosis of tracheoesophageal fistula, and it is used in Hollander's test. What is this Hollander's test? It is used to check the completion of vagotomy. So this is used to check, Hollander's test is used to check the completion of vagotomy. Clear? So these are the diagnostic indications. What are the therapeutic indications? You have seen in surgery, especially in surgery ward, that anybody who is having gastric outlet obstruction, small bowel obstruction, perforation, peritonitis, upper abdominal surgeries, or patients who are having variceal bleeding, in all these cases, Ryle's tube is used for proximal decompression. So it is used for proximal decompression. Second, it is used for the nutrition also. What kind of nutrition? Enteral nutrition. So what are the therapeutic indications? First, it is used for decompression. It is used for decompression. So in which conditions? Intestinal obstruction, in patients of gastric outlet obstruction, if patient is having upper GI bleed, or in the patient if upper abdominal surgery is performed. Why? Because in post-operative period patients are having ileus. So for proximal gastric decompression, or for proximal decompression, we are using the Ryle's tube. And another use is nutrition. So you have seen that we are giving liquids via Ryle's tube. So this is for enteral nutrition. Enteral nutrition. So these are the diagnostic and therapeutic indications of Ryle's tube. So tell me, what's the name of this tube? It's relatively shorter as compared to Ryle's tube, but almost indications are same, and it is used in infants and children. Since it is used in infants and children, indications are almost same. So this is infant feeding tube. How to differentiate it from Ryle's tube? First, obviously, it is shorter. What are the other differences? Can you see? There is presence of metallic balls at the end. These are known as shots. And here you can see there are no shots. So in infant feeding tube, no shots. Second thing, in Ryle's tube, you can see that there are markings. On Ryle's tube there are markings, but in infant feeding tube there are no markings. So here, no shots in infant feeding tube, and there are no markings There are no shots, no markings. What are the uses? The uses are similar to Ryle's tube. Name is infant feeding tube. So the uses are similar to Ryle's tube, but it is used in infants and children. It's used in infants and children. This is infant feeding tube. Now see this tube. What is the shape of this tube? The shape is like T. So what's the name of this tube? This is Catheters T tube. And you must be knowing in which situations or conditions we are using Catheters T tube when we perform the choledochotomy. After choledochotomy, we insert the T tube and we perform the repair over T tube. So what's the use of this Catheters T tube? It is used after choledochotomy. Okay, so see how we perform the choledochotomy. Imagine this is the liver, this is the gallbladder, this is the bile duct, and this is the duodenum. So if you see the blood supply of bile duct, it is coaxial at 3 o'clock and 9 o'clock, and it is mainly from inferior direction. Can you see how much? 60%. So there is coaxial blood supply mainly from inferior direction. That's why if we have to perform choledochotomy, we have to go for longitudinal incision. Why? If you go for transverse incision, since there is coaxial blood supply, the blood supply is divided, and what happens? There is ischemia. Because of this ischemia, there is increased risk of stricture formation. So first important point, what kind of incision is given in choledochotomy? It is the longitudinal incision. So we give this longitudinal incision. After that, we have to insert the T tube, and after inserting the T tube, we are going to perform the repair. So this T tube acts as a stent and healing occurs over T tube. Generally, in emergency choledochotomy, we use the T tube. Example, you have seen patients of cholangitis. So after conservative management, if patient is not going to improve, we go for ERCP with stenting. If patient is not improved, we go for PTC with stone removal and stenting. If both of these are not available or failed, what we go for? We perform choledochotomy, we relieve the obstruction, put the T tube and perform the repair. On which day the T tube cholangiogram is done? On 7th to 10th day. In such patients, on 7th to 10th day, we perform the T tube cholangiogram, and if there is distal filling defect, we retain the T tube for 4 to 6 weeks, and by Burheen's technique, we remove the stone. Clear? So this is one of the indication. So in most of emergency bile duct surgery or choledochotomy, we use Catheters T tube. See, what's the name of this tube? This was asked many times in AIIMS and NEET. This is Singh-Steichen-Blakemore tube, in short known as SB tube. How to identify? See how many balloons are there. So there is gastric balloon and there is esophageal balloon. So how many balloon? 2. So it is double balloon tube. How many lumens? If you see, this is for gastric balloon port. So this port is for gastric balloon, and this red colored port is for esophageal balloon. Can you see there is a third port, and this is for aspiration channel. So this is gastric aspiration port. Can you see these openings? Yes. So these are gastric aspiration openings. Okay. So how many balloons? 2 balloons. How many lumens? 3 lumens. So this is double balloon triple lumen tube. What's the name? This is double balloon and triple lumen tube. So this is double balloon triple lumen tube known as Singh-Steichen-Blakemore tube. So you know in which patients we are using this Singh-Steichen-Blakemore tube. This is used for controlling the varicose bleeding. Suppose after medication the varicose bleeding is not controlled, so we are going to insert this tube, and it is used to work like a tamponade. So it is used to work for esophagogastric tamponade, right? Problem: the patients in whom there is variceal bleeding, the blood is going to collect into the stomach, so stomach is distended. Second, certain patients at the time of presentation are in the state of shock. 2 important points: stomach is distended and the patient is in the state of shock. So if you are not very careful during insertion, what's the problem? There is aspiration. So question: most common complication of SB tube insertion It's aspiration. So what should be protected during insertion? Airway. Important point. So what's the most common complication during insertion? The most common complication during insertion, and that's aspiration. Clear? So what is protected? Airway should be protected at the time of insertion. First important question. Second, for inflation of balloon, which substance is used? We are going to use only air. Why? Because it is easy to inflate and deflate the balloon with air. Use of water saline contrast is contraindicated. Now see how we are going to use it. We have inserted it, and after inserting we are going to inflate this gastric balloon with 50 ml of air, and after that we are going to pull it so that this gastric balloon is stuck at G junction. And when it's stuck at G junction, then we are sure that esophageal balloon is in the esophagus. After that we are going to inflate this gastric balloon further with 250 ml of air. So there is 300 ml of air here in the gastric balloon, and then we start inflating the esophageal balloon. So in this image you can see, first we are going to inflate it with 50 ml of air. After that 250 ml of air. So total there is 300 ml of air in the gastric balloon. It is distended. We discussed that there is aspiration channel, so there are multiple openings. So whatever the content is there into stomach, that is aspirated via third port. So this is for gastric aspiration. We have to inflate this esophageal balloon, right? What is the pressure which esophageal balloon should exert on esophagus? So the maximum pressure exerted should be 35 to 40 mmHg. Maximum pressure exerted by the esophageal balloon should be 35 to 40 mmHg. Another question, why beyond this pressure perfusion stops? So there is ischemia followed by perforation. Another important point, every 12 hourly we have to deflate the balloon. Which balloon? Esophageal balloon. So another important point, we have to deflate the esophageal balloon every 12 hourly. So I'm repeating three questions. Total amount of air used to inflate the gastric balloon 300. Maximum air exerted by esophageal balloon 35 to 40 mmHg, and every 12 hourly we have to deflate the esophageal balloon. So what are the uses of Sengstaken-Blakemore tube? So it is used to control the variceal bleeding. It is used to control variceal bleeding when it's not controlled by medicines. Clear? So when variceal bleeding is not controlled by medicine alone, it is used to control variceal bleeding. Second, when we are transporting a patient to higher center, to control bleeding during transportation. So to control bleeding during transportation. Sengstaken-Blakemore tube is used. There are two similar tubes which are also asked frequently. One is Minnesota tube and the second is Linton necklace tube. So how it looks? So here you can see it is Minnesota tube. So just like Sengstaken-Blakemore tube, it is also used for esophagogastric tamponade therapy. What's the use? Just like Sengstaken-Blakemore tube, it is also used for esophagogastric tamponade therapy. Tamponade therapy means it is going to control the bleeding with compression or with pressure. What are the differences? First, see how many balloons are there. So there is gastric balloon and there is esophageal balloon. So there are two balloons. Now see the lumen. How many lumens are there? So here you can see this is 1, this is 2, this is 3, and this is 4. There are 4 lumen. So what is the additional lumen here? You can see there is a port for gastric balloon like Sengstaken-Blakemore tube. There is a port for esophageal balloon like Sengstaken-Blakemore tube, and there is a gastric aspiration port. This is additional. What here? There is esophageal aspiration port It means if you insert this tube, you can perform the aspiration of gastric content and you can perform the aspiration of esophageal content. It means with the help of this Minnesota tube, aspiration below the balloon and above the balloon can be done. So that's why for esophagogastric tamponade therapy, this is preferred over Sangstecken-Blakemore tube. I'm repeating, 2 balloons, gastric balloon, esophageal balloon. How many lumen? 4 lumen. 1 for gastric balloon, 1 for esophageal balloon, 1 for gastric aspiration and 1 for esophageal aspiration. So we can perform the aspiration from stomach, we can perform the aspiration from esophagus. So aspiration can be done below the balloon, above the balloon. So that's why this one is preferred over Sangstecken-Blakemore tube for esophagogastric tamponade therapy. What's the name? Minnesota tube. And this was the question in INI CET 2020. Latest question. This was the image based question in INI CET 2020. Now see, what's the name of this tube? This is Linton necklace tube. And here you can see that there is a single balloon, that's gastric balloon. So if there is single balloon, gastric balloon, so this is going to control the bleeding from stomach. So if the patient is having isolated gastric varices, we are using this tube, Linton necklace tube. How many lumens? So here you can see there is esophageal aspiration port, there is gastric aspiration port, and there is gastric balloon port. So one port is for balloon, second is for aspiration below the balloon, and third is for aspiration above the balloon. Clear? So 1 balloon and 3 lumen. How much air is used to inflate this gastric balloon? We use 400 to 700 ml. So how much air? We are using 400 to 700 ml of air for inflating the gastric balloon. And what's the use? Since it is only used in stomach, so it is used for treatment of bleeding gastric varices. So it is used for treatment of bleeding gastric varices. Okay, nowadays lots of image based questions are asked and the students are confused between these tubes. So let's have a comparison. So it is easy to identify. In Sangstecken-Blakemore tube there are 2 balloons, and how many lumens? There are 3 lumens. So there is double balloon, triple lumen. Clear? And you can see this is Minnesota tube. So how many balloons? There are 2 balloons. So there are 2 balloons, and what you can see, how many lumens? 1, 2, 3 and 4. So there are 4 lumen. So in Minnesota tube, 2 balloons, 4 lumens. And if you see this Linton necklace tube, there is a single balloon, and how many lumens? 3. So there is single balloon and 3 lumens. Clear? So easily on image you can differentiate these 3 tubes, and all of these 3 are used for tamponade therapy to control the varicose bleeding. These 2 for esophagogastric bleeding, and this is used only for gastric varicose bleeding. See, what's the name of this catheter? This is Foley's self-retaining balloon catheter, also known as Foley's catheter. So here you can see balloon, and this balloon is responsible for self-retaining behavior of this catheter. So this is Foley's self-retaining balloon catheter. In this you can see this is 2-way and this is 3-way Foley's catheter. In 2-way Foley's catheter you can see this is main channel, this one is main channel. And what's the use of this main channel? Main channel is for drainage of urine. So this main channel, it's for drainage of urine. Okay, and here you can see there is a small channel, the channel on which this color is there. So this is the small channel, and this channel is for the inflation of balloon. So here you can see the balloon, small channel, it's for the inflation of balloon. You can see this balloon. So main channel for drainage of urine, small channel for inflation of balloon. If you see this 3-way Foley's catheter, here you can see this is the main channel, This is the small channel for inflation of balloon, and you can see there is a third channel. So what's the use of this third channel? This is used for irrigation. So this third channel, it's used for irrigation. And if you have seen the patients of TURP, transurethral resection of prostate, since there is ongoing bleeding, so ongoing irrigation is going on. Sometimes there is post-operative bleeding, so to avoid occlusion of catheter, ongoing irrigation is going on. So with the help of this three-way catheter, we are performing the irrigation in TURP patients. So what's the material of Foley's catheter? It's made of latex. What is the advantage of this latex? Advantage of latex is that there is less irritation and less crust formation. So there is less crust formation. Okay. Now see the important points related to the balloon. How much is the capacity of this balloon? It is 5 to 50 ml. If you have inserted Foley's catheter in ward or in emergency, with how much saline we are going to inflate the balloon for self-retaining purpose? So we are generally using how much saline? 10 ml. So for self-retaining, important point, for self-retaining, generally how much saline we use or inflate the balloon? We are going to inflate the balloon with 10 ml saline. There is a second use of this balloon. What? It can be used for hemostatic compression effect. So what's that hemostatic compression effect? The patients in whom TURP is done, sometimes in the post-operative period there is bleeding from operative site. So what you do? You inflate this balloon with 30 to 50 ml saline. So we are going to inflate the balloon with 30 to 50 ml of saline. So it is having hemostatic compression effect. What else we do? We pull the catheter. So after inflating the balloon with 30 to 50 ml of saline, we pull the catheter and we are going to tape the catheter over the inner aspect of thigh. So another important property, that for hemostatic compression effect, we inflate the balloon with 30 to 50 ml of saline. We pull the catheter and tape it to the inner aspect of thigh. For the size of catheters and tubes, there are two systems which are used. One is French and one is Gauge. So you know that in French system, the size increases with increase in French, and in Gauge system, size decreases. So how to calculate? Suppose for some tube or catheter, French is given. How will you calculate the outer diameter? It's not inner, it's outer diameter. So see, outer diameter in mm for any catheter. Outer diameter, you have to remember, outer diameter in mm is equal to French by 3. Now imagine if the size of catheter is 18 French. Okay, so what's the outer diameter? It is 6 mm. So outer diameter in mm is equal to size in French divided by 3. This is how we assess or calculate the outer diameter of catheter. See what are the various sizes of catheters available. So if we see for pediatric patients, what are the sizes of catheters which are available? So this is 4, 6, 8, 10, and the sizes which are larger than 10, these are used for adult patients. So if you see in adult patients, so for adults, what are the sizes which are used? So obviously 12, 14, 16 and 18. 12, 14, 16, 18 used for adults, and for pediatric patients we are using 4, 6, 8, 10 French. Out of 12, 14, 16, 18, which one is most commonly used for males and which one is most commonly used for females? So if you see this 16 number, this is most commonly used for males. And what's the color of 16 French Foley's catheter? It's orange. And for females we are using this 14 French. So for females we are using 14 French, and what's the color? It's green. Nowadays color coding of cannula, color coding of Foley's catheters is very hot topic, frequently asked names. For males we use 16 French catheter, that is of orange color, and for females we use 14 French Foley's catheter, that's of green color. So see the color coding of Foley's catheter. So if you see gray, what is the size? 10 French. So see the color, it's gray and the size is 10 French. White color, size is 12 French. Here you can see green, that is 14 French, most commonly used in females. Here you can see orange, 16 French, and this is most commonly used in males. This is red, can you see here? Red. And what is the size of red catheter? 18 French. Yellow is 20, violet is 22, and blue is 24 French. So how to remember? It's very easy. The mnemonic is gray, white, gory, Valentine, babe. Gray, white, gory, Valentine, babe. Okay, you have to start from 10 French. So gray is 10 French, white is 12 French, G, that's green, that's 14, O, that's orange, that's 16, R, that's red, 18, Y, that's yellow, 22, Valentine, V, that's violet, 22, and B, that's blue, 24. Easy to remember. Gray, white, gory, Valentine, babe. Gray 10 French, white 12, green 14, orange 16, red 18, yellow 20. Violet is 22 and babe blue is 24. These are the 4 catheters which are commonly asked. So for females, what's the size? 14 French, color green. For males, most commonly used orange, that's 16 French. You have to remember. Red is of 18 French, and yellow is of 20 French. See the uses of Foley's catheter. Various uses of Foley's catheter. So you have seen in emergency that we use Foley's catheter to relieve urinary retention. In post-operative patient, critically ill patient, to measure urine output, or in OT also we insert Foley's catheter to measure urine output. If we have to give intravesical chemotherapy for CA bladder, we use Foley's catheter. Sometimes we discuss the 3-way catheter is used for irrigation. So in the patients of TURP, for irrigation we use 3-way Foley's catheter. It can be used for suprapubic cystostomy also. You have seen when we perform suprapubic cystostomy, we insert a special catheter. When this patient comes in follow-up, generally we remove the catheter and we insert the Foley's. So it can also be used for suprapubic cystostomy. So these are the various uses of Foley's catheter. These are Nilaton's catheter. And what's the use of Nilaton's catheter? These are used for one-time drainage of bladder, either during surgery or after surgery. So see, what are the uses? What are the uses of Nilaton's catheter? So generally it is used by anesthetist for emptying of bladder during or after surgery. So if they have to determine the amount of urine in bladder and if Foley's catheter is not in place, so we insert this Nilaton's catheter to determine how much urine is there in the bladder. So these are the uses of Nilaton's catheter. What's the name of this catheter? This was asked 2 to 3 times in AIIMS. This is Fogarty embolectomy catheter. It is having a balloon at the tip. So it is also known as Fogarty balloon catheter. What's the name? Fogarty embolectomy catheter. It is also known as Fogarty balloon catheter. How to identify? Can you see? It's a hollow tube. Can you see? It's hollow tube. And the identifying feature is what? That there is a balloon at the tip. So here you can see there is balloon at the tip. So the name of this catheter is Fogarty embolectomy catheter. It means it is used for embolectomy. So in any vessel, if there is freshly formed embolus, we insert the catheter. Beyond that embolus, inflate the balloon and we take out that embolus. How it's used? Have a look. So in this picture you can see that this is the embolus. We are going to insert the catheter through the embolus. Beyond this embolus, you can see this is the balloon. We inflate the balloon and then we pull the catheter. So what you can see that we are going to remove the thrombus or embolus. So this is how we use Fogarty embolectomy catheter, and it is used to remove freshly formed embolus in the vessel. You have seen this catheter frequently used in surgery. What's the name? This is Mallicott's catheter. How to identify? Can you see? There is presence of umbrella or flower at the tip. Here you can see umbrella or flower at the tip. So because of this umbrella or flower at the tip, it is self-retaining. So first, this Mallicot's catheter, it's self-retaining. And how we are going to identify? Yes, this catheter is having this umbrella or flower at the tip. So what are the uses? Suppose Foley's catheter is not available, so it is used for drainage of urine also. If some drain is not available, even intercostal drain is not available, you can insert this. If there is percutaneous nephrostomy and we have to drain urine, we can use it. For intraperitoneal collection, we can use this Mallicot's catheter. So see what are the various uses. So Mallicot's catheter is used for drainage of urine from the bladder, drainage of urine from percutaneous nephrostomy. Okay, if there is some intraperitoneal collection, it can be used for drainage, and if chest tube is not available, it can be used as intercostal drain. So these are the various uses of Mallicot's catheter. How to identify? There is presence of umbrella or flower at the tip. What's the name of this catheter? See the color, it's red. This is red rubber catheter. How to identify? Can you see this tip? This tip is rounded and blunt. What kind of tip? There is rounded and blunt tip. So see, there is rounded and blunt tip. You can see that there is no balloon. It means this catheter is non-self-retaining. And what is the use of this catheter? It is used for drainage of urine. So this is non-self-retaining urinary catheter. So this is first important point. It is non-self-retaining, and since it is used for drainage of urine, so this is non-self-retaining urinary catheter. So what are the uses? So it's non-self-retaining, that's why it is temporarily used to drain urine from the bladder. Why? Whenever we want to estimate the residual urine, so we use the red rubber catheter. So what are the names of these catheters you have seen frequently used in anesthesia, medicine and surgery? These are central venous catheters. And you have seen that via these central venous catheters we are giving fluid, blood, nutrition or medication. How we are going to use it and what are the preferred vessels? If a question is asked, what's the preferred vein for central venous catheterization? Preferred vein, what's the preferred vein for central venous catheterization? Frequently asked question, and that is what? Subclavian vein followed by internal jugular vein followed by femoral vein. So it is subclavian vein followed by internal jugular vein followed by femoral vein. Now see the language of question. Preferred vein for central venous catheterization inside OT. So inside OT, which one is preferred? It is the internal jugular vein. Outside OT, which one is preferred? It is subclavian vein. And third, in acutely injured, critically ill patient, which one is preferred? Femoral. So three important questions. Preferred vein for central venous catheterization inside OT, outside OT, and acutely injured, critically ill patient, So inside OT, which one is preferred? It is internal jugular vein. Outside OT, which one is preferred? Overall, which one is preferred? Subclavian vein. And if it's urgent, acutely injured, critically ill patient, so we use which one? Femoral. So these are the questions related to veins. How we insert it? Where is the tip of this catheter? So in this picture you can see that the tip of catheter is located in superior vena cava. So here you can see that the tip is located in superior vena cava, and overall most commonly preferred vein is what? This is subclavian vein. So this subclavian vein is most commonly preferred. Now there are two questions related to complications. First, what's the most common complication of central venous catheterization? And if it's there for long duration, there is catheter related sepsis. This was asked many times. Catheter related sepsis. So most common complication of central venous catheterization, catheter related sepsis. And sometimes you have seen when anesthetist is inserting this central venous catheter, patient is going to develop pneumothorax. Why? There is injury of apex of lung. So just after insertion, we send the patient for chest x-ray. So what's the most dangerous complication of central venous catheterization? And it's the pneumothorax. Most dangerous complication, and that's the pneumothorax. Cannulas, color coding, their sizes. These are frequently asked in AIIMS and NEET PG. So see first the sizes. Orange cannula, it is having 14 gauge. The size is 14 gauge. Gray 16, green is 18, pink is 20, blue is 22, yellow is 24, and violet is 26. This is the color coding. Now see what is the flow rate of various cannulas and what are the indications. So what's the size of orange? It is 14 gauge. How much is the flow rate? It's maximum. This flow rate is asked nowadays. So this is 240 ml per minute. The flow rate is 240 ml per minute. The gray cannula, what's the size? It is 16 gauge. And how much is the flow? This is 180 ml per minute. Okay, both of these are having similar indications. So generally we are using orange and gray cannula in trauma and surgical procedures. So where we are going to use? These are used in trauma and surgical procedures. Orange and gray. Now see green. What's the size? 18 gauge. And how much is the flow rate? Just half of gray, and that's 90 ml per minute. So what's the use of green cannula? It's used for trauma patients and for quick blood transfusion. So it is used in trauma patients and it's used for quick BT, quick blood transfusion. What's the size of pink cannula? It's 20 gauge. How much is the flow rate here? It's 60 ml per minute. And you have seen that it is frequently used in adult patient in medicine ward. So what's the use? It's used for IV fluids and this is also used for blood transfusion. Pink cannula, flow rate 60 ml per minute, used for IV fluid administration and blood transfusion. Blue, the size is 22 gauge and how much is the flow rate? 36 ml per minute. And generally you have noticed that this blue cannula is used in children and older adults. So what's the use? It's used in children. So you have seen use in the pediatrics ward and older adults who have friable veins. The size of yellow cannula is 24 gauge. And how much is the flow rate here? The flow rate is 20 ml per minute. And this is also used frequently in the pediatrics ward. So this is used for neonates. It's used for children and elderly. Yellow, it's used for neonates, children and elderly. And what's the size of this violet? Violet is of 26 gauge. How much is the flow rate here? It's 13 ml per minute. So the flow rate is 13 ml per minute and this is used for neonates. Right? So these are important points. What are the set of questions which are asked? First set is on the basis of color coding, they ask you the gaze. And second, on the basis of color coding, they ask you what's the flow rate. Clear? And what are the uses of cannula? So it's very, very important. Color coding of cannula and color coding of Foley's catheter, specially asked in AIIMS. So how to remember the sizes of cannula according to the color? So see, mnemonic is organized green, pink, violet. So OR, this is orange. And what was the size? 14 gauge. G, that's gray. What was the size? 16. For green, it's 18. For pink, it's 20. B means blue. And blue is 22. Why? That's yellow. 24. Violet, that's 26. So the mnemonic is organized green, pink, violet. Orange 14, gray 16, green 18, pink 20, blue 22, yellow 24 and violet 26. So this is how we can easily remember the color coding of cannula and their sizes. This was an image based question in AIIMS and it was asked for the first time. What's the name of this catheter? This is chemo port. So what is this? This is totally implantable venous access device. Chemo port, it is totally implantable. Totally implantable venous access device. Okay, so where we are going to implant this chemo port? Obviously in a vein. What is the preferred vein? Two veins which are commonly used. One is internal jugular vein and the second is subclavian vein. So for chemo port, internal jugular vein and subclavian vein is frequently used. Now what's the name? The name is chemo port. Right, so the name is chemo port, so the term is self-explanatory. There is port for chemotherapy. So chemo ports are used for chemotherapy administration. So the patients who require chemotherapy, generally we are going to insert the chemo port and it is used for 1 to 2 years. So what's the use? This is for chemotherapy administration. Name is chemo port, so it is for chemotherapy administration. And generally for how long it is there or for how long it is retained, we are going to retain it for 1 to 2 years. Clear? So the patients who are going to require chemotherapy for longer duration, chemo port is used. So in this patient you can see that this chemo port is inserted into which vein? See here, this is subclavian vein. So in subclavian vein this chemo port is inserted. See what are the parts. So if you see this chemo port, there are palpation bumps, so with which you can feel there is presence of septum, and there is a power port. Clear? And there is power lock. So whatever the needle which is attached, it is attached here. Here you can see the catheter placed beneath skin and this is inserted into a blood vessel. So via this chemo port we are going for chemotherapy administration and generally it is retained for 1 to 2 years. What are the complications? So the complications associated with insertion and retention are catheter embolism. Sometimes there is occlusion of chemo port, that's known as port occlusion. So the vessel in which it is inserted, there is vascular thrombosis. So the complications are catheter embolism, port occlusion and vascular thrombosis. So this is all about catheters, tubes and drains.